Imagine this. You're lying in a hospital bed, and the room smells like antiseptic and clean cotton. There's a monitor beeping softly beside you, tracking two heartbeats, yours and the tiny one inside you. A nurse adjusts your IV. An anesthesiologist is on standby down the hall. Your partner is scrolling through their phone, texting family updates. Everything is calm, controlled, measured. If something goes wrong, there are 17 layers of backup. A surgeon, a blood bank, a neonatal intensive care unit with machines that can keep a 1-pound baby alive. Now rewind the clock about 100,000 years. You're in the same condition, same swollen belly, same contractions starting low and deep, but you're squatting in tall grass somewhere in East Africa, and the nearest thing to medical technology is a sharpened stone. There is no hospital, no doctor, no medicine, not even a word for medicine. And this moment, right here, is statistically the most dangerous thing that will ever happen to you. So the question is brutally simple. For hundreds of thousands of years, with no surgery, no painkillers, no sterile tools, how did human beings manage the most dangerous biological event our species performs, and not go extinct doing it? The answer starts with a problem most people never think about. Walking upright nearly killed us. Not in some vague metaphorical way, literally. When your ancestors shifted to bipedalism, somewhere around 4 to 6 million years ago, the pelvis had to completely reshape itself. It narrowed. The birth canal, the bony passage a baby's head has to fit through, became a tight, curved tunnel, instead of the relatively straight, wide channel that other primates have. A chimpanzee gives birth in minutes, often alone, sometimes barely pausing in what she was doing. For humans, labor became an hours-long ordeal through a passage that barely fits the cargo. And here's what made it worse. While the pelvis was shrinking, the brain was growing. Between 2 million and 300,000 years ago, hominin brain size nearly tripled. Anthropologist Robert Martin at the Field Museum in Chicago called this the obstetric dilemma, the collision between a pelvis built for walking and a skull built for thinking. Evolution's answer was a compromise that still haunts every delivery room on Earth. Human babies are born neurologically unfinished, months earlier in development than they should be, because if they stayed in the womb any longer, their heads simply would not fit. Your baby comes out helpless, skull bones unfused, barely able to see. That's not a flaw. That's the deal evolution cut, so that both mother and child could survive the exit. Think about that for a second. Every human being alive today exists because this impossible engineering problem got solved, not by getting easier, but by getting just survivable enough. But surviving the anatomy was only half the battle. The real question is who was in the room, or more accurately, who was on the ground beside you. Because here's the part nobody talks about. Humans are essentially the only primates that almost never give birth alone. Anthropologist Wenda Trevathan at New Mexico State University spent decades studying what she calls obligate midwifery, the idea that human birth is so mechanically difficult that having a helper isn't a luxury, it's a biological necessity. In most primates, the baby emerges facing the mother, so she can reach down, clear its airway, guide it out. In humans, because of that twisted birth canal, the baby usually comes out facing away from the mother. Try reaching behind yourself and pulling a slippery 7-pound object safely past a cord wrapped near its neck. You can't. You need another pair of hands. This means that midwifery, one person helping another through birth, isn't some cultural invention that came along with civilization. It may be one of the oldest human behaviors that exists. Older than agriculture, older than cave painting, possibly older than language itself. At Shanidar Cave in northern Iraq, Neanderthal remains dating back 60,000 years show a community clearly caring for injured and dependent members. If they were keeping a man alive who had lost the use of his arm, it's almost unimaginable they were leaving laboring mothers to fend for themselves. The help was there. It had to be, because without it, we simply don't make it as a species. And those helpers knew things, not from textbooks, obviously, but from something just as powerful, accumulated observation passed from mother to daughter across thousands of generations. This is where the story gets genuinely remarkable. Your ancestors developed what you might call a living oral technology of birth. They knew which positions helped. They knew that movement during labor, walking, rocking, squatting, worked better than lying flat, something modern obstetric research only formally confirmed in the late 20th century. A 1999 Cochrane review of over 5,000 births found that upright positions shortened labor and reduced the need for intervention. Your great-great-great-grandmother, 100,000 greats back, already knew this. She knew it in her bones. Here's what doesn't make sense until you think about it. Your ancestors also figured out pain management without chemistry, continuous physical support during labor, touch, pressure on the lower back, rhythmic vocalization. These aren't just comforting. They trigger oxytocin release and reduce cortisol. A study led by John Kennel and Marshall Klaus in the early 1990s found that women who had continuous one-on-one support during labor had 50% fewer cesarean sections and significantly shorter labors. The mechanism isn't magic, it's neurochemistry. But your ancestors didn't need to understand the mechanism. They just needed to notice that when the experienced older woman held the laboring mother's hand and hummed and pressed against her spine, things went better, so they kept doing it. For 100,000 years, they kept doing it. But let's not romanticize this, because the brutal truth is that even with all of this knowledge, all of this community support, a staggering number of mothers and babies died. The mortality numbers are hard to pin down for deep prehistory, but bioarchaeologist James Scott at Cambridge and others have estimated that pre-agricultural maternal mortality rates may have hovered somewhere around 1 in 30 births. Maybe higher. That means if you were a woman in a band of 30 or 40 people, you personally knew someone who had died in childbirth. You might have watched it happen. You might have held the baby after. And here's where the story takes its most unexpected turn. That loss, that grief, may have been one of the forces that accelerated human social bonding. Anthropologists studying modern hunter-gatherer groups like the Hadza of northern Tanzania and the Aka of Central Africa have documented something striking. When a mother dies, the community absorbs the child almost instantly. Grandmothers, aunts, older siblings, even unrelated women who are currently lactating will nurse the orphan. This isn't charity in the way we think of it. It's infrastructure. It's a survival system so old and so deep that it feels like instinct. The anthropologist Sarah Blaffer-Hrdy at UC Davis calls it alloparenting, literally other parenting, and argues it's one of the defining features of our species. We are not a species where the mother alone raises the child. We never were. The village isn't a metaphor, it's a biological strategy. This also explains something about pregnancy itself that seems strange until you see it through ancient eyes. Morning sickness, that miserable nausea in the first trimester that modern women treat with ginger ale and saltines? Evolutionary biologist Margie Profit proposed in 1992 that it's actually an adaptive defense mechanism, the body's way of making the mother avoid foods most likely to carry pathogens or plant toxins during the exact window when the embryo is forming its organs and is most vulnerable. The foods that trigger the worst nausea, bitter vegetables, strong-smelling meats, anything even slightly off, are precisely the foods most likely to carry harmful compounds. Your ancestor didn't know about listeria or toxoplasmosis. Her body did the knowing for her, making her gag and retch until she stuck to the safest, blandest options available. And the body had other tricks. Pregnancy cravings, which seem random and weird to us, may have been targeted nutrient-seeking behavior. A craving for red meat signals iron deficiency. A craving for dirt, yes, actual soil, a behavior called geophagy, documented in pregnant women across sub-Saharan Africa and Aboriginal Australia, may be the body seeking minerals or clay that binds to toxins in the gut. Researchers at Cornell, led by Sarah Young, published a comprehensive analysis in 2011 showing that geophagy is most common in pregnant women and young children, the two groups most vulnerable to parasites and nutrient gaps. This isn't bizarre behavior. It's the body running ancient software. Now zoom out. Think about everything stacked against your ancestors. A pelvis that was too narrow, a baby's head that was too big, no pain relief, no surgery, no antibiotics for the infections that followed, no blood transfusions when hemorrhage hit. And hemorrhage hit often, postpartum bleeding is still the leading cause of maternal death worldwide. Even today, killing an estimated 70,000 women every year according to the World Health Organization. Against all of that, here is what they built. They built knowledge, body knowledge, passed hand to hand, voice to voice, surviving every generation that carried it. They built community, not as a nice idea, but as a medical system, A web of hands that caught you when biology tried to kill you. They built their own bodies into shields, with nausea that filtered poison and cravings that sought what was missing. And they built grief into a bridge, turning every loss into a stronger web of alloparents, who made sure the next baby, and the next, would survive. This is not a story about how hard things used to be. That framing is too easy and too self-congratulating. This is a story about the depth of intelligence that existed long before anyone could write a word of it down. Every technique your ancestors used, upright birth positions, continuous labor support, community-based infant care, is now being rediscovered by modern medicine, published in journals, and called evidence-based practice. They were the evidence. They just didn't have the journal. So tonight, or tomorrow morning, or whenever it happens, you'll walk past a hospital, maybe a birthing center with its calm pastel walls and adjustable beds and fetal heart monitors blinking in the dark. And all of that is extraordinary. All of that saves lives every single hour of every single day, and you should be grateful it exists. But somewhere underneath it all, underneath the beeping monitors and the sterile gloves and the epidural drip, the oldest system is still running. A hand gripping another hand. A low voice saying, "You're okay, keep going, I'm here." A body that knows things no textbook taught it. A circle of people who showed up not because they were paid to, but because 100,000 years of survival wrote it into the species. You do not do this alone. Every person you have ever known, every person you have ever loved, every face in every crowd you've ever passed on the street entered this world through that narrow, ancient door. And on the other side of it, every single time, there were hands waiting.